I'm Dr. Michael Barnett with OrthoUnited, and I'm an orthopedic foot and ankle specialist. I grew up in Milford, Ohio, which is just east of Cincinnati. Went to Ohio University for undergrad and made my way out to Wright State University in Dayton for medical school. And then was up in Akron for residency for 5 years at Akron General. And after that, I did a fellowship up in Portland, Maine with the Portland Orthopedic Foot and Ankle Center, just doing foot and ankle orthopedic surgery for 1 year. Following that, I had the opportunity to go back to my medical school, and I joined them as an assistant professor at Wright State University, where I was doing mostly foot and ankle surgery and some general orthopedics, and then gradually transitioned into doing all foot and ankle. And then after a few years, we decided to all move over to Premier Orthopedics, which was the Level 1 Trauma Center hospital system down in Dayton, Ohio. And for those years while I was down there, the past 18 years, I've been the foot and ankle consultant for the Wright State University and University of Dayton athletic teams, in addition to a bunch of the high school programs down there. We, as a family, decided to move up here because we have half of our family down in the southern part of Ohio and half in the northeastern part of Ohio. So we decided to come back up and be with family. So far, Stark County's been a great place to live. We've been here just under a year. It's been a nice place to work and live, and we're very excited. I am an orthopedic foot and ankle specialist. We do everything involving the foot and ankle, and that includes degenerative conditions such as arthritis, rheumatoid arthritis, also complications from diabetes and other chronic medical conditions. We also do traumatic problems like Achilles tendon ruptures, ruptures of other tendons in the foot, ligament tears, bone fractures. I also treat congenital type conditions, things that people are born with or develop during their life. We have advancements going on daily where we're constantly coming up with new techniques, new ways to treat things minimally invasive, such as bunions and flat feet and things like that, where we do much smaller incisions than we used to do, and we have less trauma to the patient, which provides quicker recovery. The majority of the people in my practice, I would say, are people that have been dealing with foot pain for a long time, and they were just afraid to go see someone because they didn't want to hear that I'm going to have a surgical procedure to get this fixed, whether they're afraid of the actual procedure itself or the time it's going to be, they have to take off work, or the fact they have to be off their foot and they can't drive a car. There's a lot of different reasons why people are afraid to come in and have this discussion. I always tell my patients the same thing: it never hurts to get information, and that's what I try to provide to everyone in the office. I try to educate them about what they have going on, and then we have a discussion about options, and the options always include conservative treatments. Patients always have the option to do nothing. They always have the option to try conservative care. Then there's some people that have just been living with it for so long, they're debilitated, and they have to consider a surgical option, and when that time comes, we're there for them. So when a patient comes in and we finally have the discussion about surgical management, I always have the conversation with them that this is what I think not only is the best way to proceed, but this is what I would do for myself. I always think, what is the best way to proceed based on what I would want as well. I always take their lifestyle into consideration, their other factors surrounding their life, such as their work and their family, what situations they're dealing with at home. All of these logistical concerns that patients have, we take into consideration, and we help guide them through this process. So our team is really good from the preoperative appointments all the way through the time of scheduling surgery, through the surgery itself, and through the postoperative care and physical therapy portion of the recovery. What's really nice for us is everyone is in-house within about a 20-foot walk. I can talk to any of those people that are responsible for that portion, including other providers if necessary, to collaborate with them. We have in-house physical therapy, which is really great. They're a short walk from my office, and I can talk to them at any time about a patient, and it's really nice having someone who works with you on a daily basis doing the physical therapy on your patients. You get to know them, they get to know you, they know my protocols. It's been a wonderful experience being able to have them so close by. I recall a patient in the past that I had that had developed this severe angular deformity of the lower leg, where he was essentially walking on the outside of his foot and could not put his foot flat on the ground because he was so bow-legged. And I remember taking him in and doing surgery on it to straighten his leg out and get his foot back flat on the ground. He had been dealing with this for over 35 years, and at our last visit, he was just extremely thankful to me, to be able to do something. He had been so afraid to go and meet with someone and have this discussion about surgical management. So that really is what it's all about for us, is we want to get to that end point with patients, and we'll work as hard as we can to get there, so that the patient's happy and they can get back to being a productive worker or student or whatever their vocation is in life.